Welcome back. September is Polycystic Ovary Syndrome Awareness Month, and this morning we are highlighting what women need to know in order to take better care of themselves. And here to help us do that is Dr. Miguel Luna, gynecological surgeon and endometriosis specialist from HCA Florida JFK North Hospital. Nice to see you again, Dr. Luna. Thank you so much for being here. Okay, so this is also known as PCOS. So
Correct.
what exactly is it, and how common is this among women?
So PCOS is essentially a response of the ovaries to a metabolic issue. Mostly it's insulin resistance. So there's certain type of genetic types that we have in women, and some of those women just become storers at some point in time after they meet a specific threshold of insulin resistance.
And what exactly happens?
So it stops ovulation. So fat cells make molecules called estrone. It's very similar to estrogen. So it kind of fakes the body into being non-ovulatory. So women stop ovulating, and that's one of the key signs of PCOS.
And what can people do?
Well, there's a lot of things that we can do. I mean, us as gynecologists, we see the patient mostly because of the lack of ovulation and lack of periods.
Is that one of the signs?
That's one of the signs. Lack of ovulation, so patients won't have periods. They'll either have, a period every 3 months, or 2 periods a year, or no periods at all. So when we see them, it's mostly diet management to fight insulin resistance with some meds as well, and lifestyle changes, and then help them with guiding through having regular cycles and things that can come from PCOS, like infertility.
What are some of the other signs and symptoms to look out for?
So there is some hair growth that is male, what we call male pattern hair growth. So kind of mustache and kind of hair between the breast or around the belly button area. That's the number one kind of telltale sign there. And just signs of hyperestrogenism, so a lot of estrogen that turns itself into testosterone, so acne as well. And then of course, central obesity.
Okay. What can people do? I know you mentioned a lifestyle change, but if there's someone watching that says, hey, I think I may have something like this, what's kind of the first step, and how is it diagnosed?
So we can diagnose it just by clinical history. Number one, there's some lab work that we can do, and then imaging of the ovaries when they look like polycystic. There's a little string of pearl appearance of the ovaries when we see it on ultrasound. If you think you have it, it's just bring it up to your primary care doctor, your primary gynecologist. It's about 13% of women will have it, so it's something that we deal with commonly.
And how does raising awareness about this help women in our community?
Well, I mean, as you know, infertility is on the rise in the United States and in the world, so this is actually a cause of infertility that is very easily fixed, because we can fix this. We can stimulate ovulation or have lifestyle changes that will kind of bring you back to having a normal, regular monthly cycle and ovulating, et cetera. So it's important to bring awareness to it as we, have more people trying to conceive.
All right, Dr. Miguel Luna, thank you so much. Always nice to see you. If you want to hear this interview or for more information, you can head to our website, WPBF.com, or download the free WPBF 25 News app. Vanessa.
And good morning now.